How would you like to save a life today? Maybe in 6 months, 2 years, far away as 10 years. Registering as a bone marrow donor could give you that unique opportunity to help someone who is in need of a bone marrow transplant. Within our lifetime, we are affected by someone who has cancer, a genetic disease, or other issues related to blood cancer. It could be a family member, close friend, or someone you just barely knew, but you met at a family gathering or work gathering. Choosing the subject was a no-brainer for me. I was directly affected by someone I loved that needed a bone marrow transplant, and I had no idea what it was. My son Giovanni was diagnosed at 5 months of having a genetic defect. He had no immune system, and his only chance of survival was to have a bone marrow transplant. So at 5 months of age, we searched with the doctors to find out if there was a match for him. Unfortunately, there was no one in the registry that matched him. So they told us, if we don't get him a transplant by the time that he's a year old, he's not going to survive. So, of course, me being devastated said, no, I'm not going to take that lying down. I'm going to fight for my son, and I'm going to find him a match. Of course, the doctors looked at me like I had two heads. I was like, well, he's my son, and I'm going to find him a match. What is it going to take? Basically, it's 1 in 20,000, if not more, to be a match to somebody. So finding a match for him is going to be quite hard. So as we searched around and started doing bone marrow drives, we learned the different ways to register people, and that's what I'm going to show you and tell you what needs to be done to be a registered donor. My main objective, of course, was to save my son, if I haven't made that clear already. To become a registered donor, you need to be between ages of 18 and 55. You would fill out a 1-page registration form and have 2 cotton swabs to the inside of your inner cheek. You rub up and down to get the shedding cells. The lab takes those cells and then they mark them individually of what your DNA is, your skin typing. So then you'd be put into the registry till you're 61 years old. All the information that is collected on that registration form is personal information, and it is treated like a document, a medical document, HIPAA protected. In the registry, no one can touch it. If you ever become a match, the registry would then contact you and let you know that you are a potential match for somebody. So upon them telling you that, they would want to know if you wanted to continue. And if you said yes, they would send you for more blood work, and then they would also tell you if it's a male or a female that you're potentially going to save, what the age is, what their disease is, and whereabouts they live, if they're in the United States or if they're in another country. Do I have your attention? Wouldn't you like to save a life? 5 to 10 minutes of your time to get on the registry. You may never get the call because it depends on the person that is sick, what their tissue typing is. You could potentially match someone. Again, 5 to 10 minutes to register, and you could save somebody's life. Wouldn't you want to do that for someone else? Family member. Wouldn't you do that for a family member? Of course you would. You would try anything possible. But in the meantime, would you want to save someone else? That's a question most people are asked. If you say no, wouldn't you want that stranger to help your family member? You wouldn't want them to say no. So that's why I say, register as a donor. Give a life, save a life. It doesn't take much time. 2 ways to donate stem cells. If you've ever donated blood, the way that they donate, 70% of the draws are done the same way that they take blood from you. Then by taking it out of the arm, they hook you up to an IV. They hook one IV into the arm, and then it goes down in a machine at the end of the bed, takes the stem cells out, puts the blood back inside you. You're in a bed for 6 to 8 hours, depending on how well you're doing. You're just pretty much relaxing the whole day. Before the actual draw, what they do is they give you a shot 4 days before and the day of. You go into the hospital, you're all taken care of, everybody's watching you, even your relatives can go there and hang out with you. Again, 70% of the draws are done that way. The other 30% are done by the actual surgical procedure. That is when they do all the testing, and then they determine that the best way to get the stem cells for this particular person that you're going to help is by doing the actual surgical extraction, which is then where they put you under anesthesia. You don't feel anything, and they take it out of the iliac crest, not your spine, kind of like where your pelvic bone is. They equate the pain to falling on your butt. But of course, you'll be medicated during and after the procedure. You can actually go home that day. I've talked to many people who have given the peripheral way and the surgical way, and they said they would jump at the opportunity to do it again. Didn't take much time or effort to think about saving a life for them, and I'm asking you to do the same thing. Possible side effects of doing peripheral: you have some flu symptoms, which go away. Who doesn't feel sick once in a while and have a cold? Side effects of the actual surgical procedure: you're sore on your tailbone. And that's usually because the stem cells are sitting in the tailbone area. So once those disperse, a couple days, your body replenishes within 2 weeks, you're fine. Anytime that you've missed out of work, you will be reimbursed by the registry. You do not have to pay for anything. They arrange for everything. So again, if you need to eat, you need to be put up in a hotel, you need transportation, you miss work, the registry reimburses you for all that time and money you've lost. No money out of your pocket. The patient's insurance pays for everything. Again, wouldn't you want to save a life? Costs you nothing. Some of your stem cells that your body replenishes within a 2-week period. Think about it. As we go on with the registry and the requirements for it, I would like to point out as well, Caucasians, there are millions of people in the registry, but what we're lacking is the different ethnicities. Your African American, your Asian, your Native Hawaiian, your Hispanic and Latino. Those ethnicities are under-registered in that registry. So we're asking all those people, please come out of register. Because usually if one of those ethnicities has that diagnosis of needing a bone marrow transplant, they usually don't get it. Again, a match is 1 in 20,000, if not more, 1 in 30,000. It's very rare to be a match to somebody. In conclusion, I would like to take the time to have you think about what I've just talked about, which is bone marrow registration. Simple procedure, 5 to 10 minutes to do. You can go to deletebloodcancer.org. They don't charge you anything. Usually it's a $65 fee, but if you don't have that fee, if you don't have that money, they don't care. They just want you to register so that you can save a life. They waive the fee. They take donations, but they would waive the fee just to have you put in the registry. Registration, again, takes 5 to 10 minutes, and I keep pushing that 5 to 10 minutes because it doesn't take long to register. You only have to do it once. Once. Chances of being a match to someone are greater than 30,000 people. It's quite a bit. You can go through the whole time on the registry and not get called at all. Or you could get called and save a life. We are all affected by cancer in some way. 6 degrees of separation. Family member, friend of a friend, co-worker. Now, if you think about that, I'm sure you're going to find a couple people that you've heard about, or that you actually knew and what they've gone through. Wouldn't you want to help to save somebody? Save your loved one? Save someone else's loved one? You don't want that little child that's waiting for a bone marrow transplant, because they're very aware of what's going on, to say to their mom and dad, Mom, Dad, did they find a match for me today? You want them parents to say, yes, we found a match for you today, and you're going to live because someone is giving you their stem cells so that you can live. When I heard that from my son, I was elated. 2 months to find one. It was a happy day. So I'm asking you again, save a life. register as a bone marrow donor. Thank you.